most people in this country depend on the government healthcare service, and if the government is able to improve healthcare service at every level, then of course we expect a lot from, we expect that the patients will get very good services and all that. And having said that, we know that the government has done a lot in the last one decade, actually in the last decade, concerning cancer, and we know now most people really are curious to know what is cancer and all that, and I'm sure this information is going down to even community and individual levels. And one of the things that I think government has done, which is very important, is that we did not have a cancer policy in this country until last few years, and they have taken the initiative to do that. And now we know there is a board that was even inaugurated, I think yesterday or something. These board members are going to look into cancer issues in terms of sensitizing the public and screening, and also advising the government actually on these gaps that we are talking about. And we know right now actually the government has also sent a lot of people to train in oncology. You know, we'll have more doctors coming in on board. And also we know Eldoret is also going to start their radiotherapy unit very soon. And these are very, I think, encouraging news.
If the money is allocated at this point and the oncologists as yet to complete their training, do you feel that the allocation will go amiss? Actually,
we have oncologists who have completed their training. Like in Eldoret, I know my 2 colleagues who've just completed in terms of radiotherapy. Oncology sector actually, oncology is a very wide, it involves actually a multidisciplinary. That's what I want to mean, in that the treatment does not involve one doctor. We have surgical oncologists coming in to operate on these patients. We have medical oncologists who only give chemotherapy. We have clinical oncologists who give both chemotherapy and radiation therapy. And also we have other palliative care doctors who takes care of these patients who have disease. So it's not only just one doctor, and we know all tertiary hospitals in this country actually have most of these doctors. Yeah.
How do you move the conversation again on the ground when you're getting the people sensitized? You've mentioned the fact that there's a gap when it comes to screening. At this point, all roads lead to Machakos County. The country is going to be recognizing World Cancer Day. What would you expect will come from the meeting there, from the government front and also from the health sector perspective, so as to boost the capacity of the individual on the ground to be better sensitized about cancer?
Yeah. I think my expectation for today's World Cancer Day is to reach as many people with this information about cancer and how it's becoming a burden in this country. And another thing I expect from this today's day, actually, people to understand that cancer, like we said, if you improve your lifestyle, just simple message that improving your lifestyle, like stop smoking, alcohol, not drinking alcohol, checking your weight, actually not to be obese and all that, sun exposures, and also physical exercise is important. And these few things that I've mentioned actually can cut down the disease by 50% from statistics that we get from other countries. I know we do not have Kenyan statistics. I'm just quoting statistics from the Western country. Yeah. And you can imagine if we keep talking about this and people know about all these preventable causes of cancer, we can be able to reduce this burden. And I think this will be great even in that.
Now we are going to the people's front. You've touched on the data. Yeah. Data is a gap that is experienced within every sector in the country. How do we need to change how we collect data? One, from your front as the medical professional, and also for the media in terms of telling the story, so as to help the government allocate its resources better.
Yeah, right now, actually, I know what I mean. We do not have proper data because, you see, not all hospitals in this country, I'm talking about cancer, not everyone sent their sample in one central place. Because, you know, for you to diagnose cancer, you need what we call histological diagnosis. And those tissues that are removed from the patient, they are not sent everywhere. But we know there's a lot going on in this country. We have Cambridge doing that. We have Nairobi National Cancer Registry. We also have Kenya Cancer Registry, and I think they're doing a lot to do this. It's only that everything, we started all this late, and that's why we do not have really data that we can quote and say these are absolute datas, yeah, unlike other countries. But we are in that direction. Yeah.
For those who are in the population that's living with cancer, share with us some of the information that you give to the population so as to better manage, one, their mental environment, their spiritual environment, even as they're taking on treatment. Would you advise to back up medical prescriptions with, you know, healthcare adjustments, for example, going herbal as well? Because that's one question that many have always felt is a controversial one, but we'd want to give it to you.
Yeah, I'm just talking this from my personal point of view. And what I know actually is that cancer treatments are there. It's one of the fields that is rapidly growing. There's a lot of research going on. There's a lot of money which has been put in actually to improve the treatments for cancer. And I would only really comment about the conventional treatment because I'm a doctor, and I wouldn't really know what the alternative people do for in terms of treating cancer. But what I can tell most people is that it's always good to go to the hospital, be checked, be tests done, so that you can know what your doctor tells you, whether, because in our practice actually we always discuss with the patient together with the family and explain to them, once we've run all the tests and get the diagnosis of cancer, we always stage the patient and know the extent of the disease. And then after that, after we've done all these things, then we discuss with them whether the treatment would be curative or palliative treatment. By curative, I mean treatment to cure. We are offering treatment with the expectation to cure the disease. And at times we give treatment with the intention we know it's to improve their quality of life in terms of pain management, making them have a good life, you know, but not really to completely eliminate the disease. And in that discussion, we always tell them that, you know what, if it's palliative, we are not curing you. Those kind of patients, I always give them alternative, because they can seek other help. They can get the treatment from the hospital together with alternative treatment. I don't think there's anything wrong with that. Yeah. But for patients who we are curing, then I wouldn't really recommend for them to get other treatment elsewhere. Yeah.
When you're looking at one of the factors that leads one to consider alternative is cost. Do you feel that the government's injection at the moment to ensure that there's subsidized cost for one, palliative care and also seeking treatment, is it coming in fast enough, and what should be done to hasten the process?
Yeah, I actually work at Aga Khan University Hospital, and I don't work with the government actually, and I don't even work in Kenyatta National Hospital and all that. So I wouldn't really be having all the information regarding what they're doing, where they've reached and all that. But what I can say from my own perspective is that the government is doing a lot now. Lately, they're doing a lot. Yeah, and I think with time, now that we have county hospitals and we have governors, and I think even today during World Cancer Day, we need also to sensitize them, the governors, so that they know, because now we know healthcare has been devolved and they're under governors and all that. We need them also to know the magnitude of this disease and what can be done to improve this. And I think we are heading in that direction. If they're pumping money to really help in this sector.
And especially in the counties?
In the then
12 billion is quite a big number.
Absolutely. It's a lot of money. It's huge money. We expect actually it will help to improve.
And maybe that's a conversation that we'll carry on with you, and hopefully a governor next time, so as to ensure that, one, the devolution of the services right from the national level to the county level ensures that the conversation of cancer is not only in doctor's office.
Absolutely.
Thank you so much for joining us, Daktari. I hope you've been sensitized on this World Cancer Day. Get yourself checked. Early detection is key. And as the theme goes, it's not beyond us. Thank you so much for joining us from the team and myself. Enjoy the rest of your viewing.